You are listening to the Horse Radio Network, part of the Equine Network family.
Hello, and welcome to this episode of the Daily Vet Life podcast, where we chat with equine veterinarians about the cases they've worked on in their clinics. I'm your host, Alex Beckstedt, Editorial Director of Equimanagement, and in this episode, I'm speaking with Dr. Wendy Gaddis about using orthobiologic therapies to manage lameness cases. The Daily Vet Life podcast is brought to you by Dechra. Dr. Gaddis runs Block and Bridle Veterinary Service, one of Northern Colorado's top equine veterinary hospitals. She graduated with honors from the Colorado State University School of Veterinary Medicine and honed her equine lameness skills at Colorado Equine Clinic in Littleton. She founded Block and Bridle Veterinary Service in 2002 and became certified in animal chiropractic and veterinary medical acupuncture in 2017. When not caring for patients, she enjoys traveling and team roping. Thank you, Dr. Gaddis, for joining us today.
Thank you, Alex, for having me. It's my pleasure to be on.
So, first of all, to get started, can you just tell us a little bit about your practice and the types of horses and cases you typically see or specialize in working with?
Sure. We are a busy equine practice. We do everything from routine preventative care to reproduction to chiropractic and acupuncture. And the majority of our caseload is equine sports medicine. Most of the horses that we work on are Western performance horses and race horses. In the Western performance world, we usually see barrel racing horses, team roping horses, calf roping horses, some reiners, and also some working cow horses. And then the race horses that we work on are quarter horses. So we do specialize mostly in sports medicine. We do a lot of intra-articular injections, and we often incorporate chiropractic and acupuncture in many of those cases.
So it sounds like with that population of horses, you probably have to really work to stay up to date on the latest therapies and technologies. Is that correct?
Yes, we do. Yeah, we do a lot of regenerative therapies and with traditional as well, but a lot of regenerative therapies on those horses.
So with that in mind, I know you do use a wide range of treatment modalities to maintain your patient's health and soundness, but I do want to focus today on orthobiologics specifically. You've had success using therapies such as IRAP and platelet-rich plasma. Can you talk us through one of those cases?
You bet. I've had a lot of success with IRAP, and I kind of chose this case as I thought it was interesting and also a great success story. So Annie is a 13-year-old quarter horse mare who's used as a working cow horse. She'd been previously seen by another veterinarian, and she was diagnosed with navicular syndrome about 4 years ago. She also had a suspensory ligament injury approximately 2 years ago that since was ultrasounded and shown to be healed. She had her coffin joints injected approximately a year ago with traditional injections with hyaluronic acid and steroids. And the owner said that the injections worked well for approximately 3 months. So Annie had recently gone back to work with a trainer, and the trainer noted that Annie had fell off in both her front end and her hind end. So during her lameness exam, I found that Annie was 3 out of 5 lame on her right front, and the lameness worsened when she was trotting to the right. She had palpable effusion, which is extra fluid, in both her left front and right front coffin joints. She also had a little effusion in her left tarsal crural joint, which is the top joint of the hock, and her right medial femoral tibial joint, which is the inside joint of her stifle. So she flexed mildly positive to the right front distal limb flexion. She also flexed moderately positive to her left hind full limb flexion, as well as her right hind hip stifle flexion. So with that in mind, I wanted to isolate that right front lameness. So I did a palmar digital nerve block on her right front, and she only had mild improvement with that block. So then I jumped up a little ways and did a Daisy sesamoid block, and her lameness improved on her right front by about 80 to 90%. And then she became lame on her left front. She was 2 out of 5 lame on her left front, as well as 2 out of 5 lame on her right hind. So I took radiographs of both front feet and also her left hock and her right stifle. She had some mild navicular bone changes in both the left front and the right front. She had her medial coffin joint space was narrowed in her right front compared to the lateral aspect of that joint. And then she had a little bone remodeling of her distal P2 at the coffin joint capsule attachment in both the left and the right front. She had a little spur starting in her right tarsal crural joint, and then she also had a small spur starting in her right medial femoral tibial joint, the right. So, but nothing mind-blowing on the radiograph. So given that they were relatively mild changes, I recommended IRAP on her. And the reason I thought we'd go with IRAP is I really like how it decreases the inflammation in the joints. And I also feel like a lot of horses, those injections will last longer with IRAP versus traditional injections. So I talked to the owner about injecting both of her coffin joints, the right stifle and the left hock, so the right medial femoral tibial and the left tarsal crural joint. And then based on how lame she was baseline on her right front, I told the owner I thought we would need to inject that right coffin joint a second time, and I would like to do that at 1 week later. So I often do IRAP injections at weekly to every other week intervals for 2 to 3 times, depending on the horse. I feel like that gives us the most benefit from the IRAP. So we injected coffin joints, the hock and the stifle. And at 1 week, I went back out to check her again. I lunged her prior to the IRAP injection in that coffin joint, and her lameness had improved from a 3 out of 5 to a 2 out of 5 on that right front. So we got the coffin joint injected for the second time. I rechecked her again at 2 weeks, and her baseline right front lameness had completely resolved. She looked great, lunging both directions and on the straight. So I went through her again and we flexed her. All of her flexions were great, except for her right hip stifle flexion. So I injected the right stifle a second time. And then I also did a chiropractic adjustment on her at that time and just touched base with the trainer. And she's been back in work for about 3 months now, and she's working great. So I think she's a pretty interesting case and a nice success story.
Yeah, those are some pretty amazing initial results right off the bat.
Yes, they were. They were great. When I find that more frequently than not with IRAP. Of course, you pick and choose what cases you feel like it's going to work on, and I just felt like she would be a good candidate for it. So, and luckily it worked.
Calling all equine veterinarians. Are you tired of feeling like you're on an island when it comes to caring for your patients? Dechra Veterinary Products is here to bridge that gap. They understand the challenges you face. That's why they offer a comprehensive line of high-quality products like Zycosan and Osphos, and empower you to offer your patients cutting-edge therapies like ProVet APC. They're not just a supplier, though. Dechra provides ongoing training and support to help you stay ahead of the curve and deliver the best possible care. Visit www.dechra-us.com to discover how Dechra can be your partner in equine health. So what kind of program would you recommend for this horse going forward as far as re-examining her, keeping her sound and in work?
Well, so she's back in full work and has been for about 3 months now. And so this trainer is really great about noticing if they feel off or not. I like to recheck those horses about every 4 months and just go through them again and reflex and make sure everything's looking good. But I'm hopeful that, her coffin joints will last closer to 6 months anyway. And actually all the joints we did are high motion joints. So 6 months is realistically what we should get out of those injections with IRAP versus your traditional injections of 3 months.
Right.
At least in my experience. So.
And then would you repeat those injections if needed?
Yes. If she needs them, we'll definitely repeat them. Yes.
So do you ever combine regenerative therapies to really maximize their effect?
Well, yeah, we do, if it's financially feasible for the client, because, it certainly the cost starts to add up. But if it is feasible, we will combine those therapies. And I did that on a horse recently. His name is Huey, and he is a 12-year-old quarter horse. He's a very talented barrel racing and rope horse. He came in and the owner just felt like something was off with him. And sure enough, he was quite lame. He was 3+ out of 5 lame on his left hind. He flexed moderately positive to the left hip stifle flexion. And he also had mild medial femoral tibial joint effusion. So we blocked the medial femoral tibial joint, which is the inside joint of the stifle, and the lameness resolved at 10 minutes. So we took some radiographs and they were very clean. So then I ultrasounded that stifle and it showed some synovitis in that medial femoral tibial joint, but really no other abnormalities were noted. However, given the degree of his lameness, I felt like there had to have been a soft tissue injury in that stifle. So I talked to the client about using platelet-rich plasma because I really like that product for tissue healing. I have great results with it. So she said that would be fine. So we waited for 2 weeks after we'd blocked him. She brought him back in and we injected that stifle with platelet-rich plasma. We rechecked Huey about a month later, and his lameness had improved from a 3+ out of 5 to a 2+ out of 5. And then we rechecked him at 6 weeks later. Well, so 6 weeks from the PRP injection. And he was still holding at about a 2+ out of 5. So I talked to her about possibly doing some IRAP on him at that point. And I told her I would like to do IRAP, a series of 3 injections on him at weekly intervals. And we rechecked him between the second and third IRAP injections, and his lameness had improved from a 2+ to what I would say was a 2- out of 5. He also was flexing much better to that hip stifle. So unfortunately, I don't know the end result with this case because we just did that 3rd injection last week. But our plan is to give him about another month off and then recheck him. However, both the owner and myself are really happy with his progress so far. So I feel like we're going to get him back with a little bit more rest and with that 3rd round of IRAP in him. So stay tuned on that one, I suppose. But so far, I'm pretty happy with how he's looking.
Yeah, maybe you can shoot us an update and we'll add it to the podcast.
Yeah, sounds great. Yeah.
So you mentioned that, sometimes finances do come into play with these cases, but in addition to that, what kind of goes into your decision making when recommending these therapies for these horses?
Well, I think a lot of it depends on their age. And so like a young horse, I really don't want to stick steroids in their joints. So I often will recommend IRAP injections on a young horse over steroids because I just don't want to start that cycle where they need those injections and we're going to start damaging their joint. I also look at horses like if they're older and they have quite a bit of arthritis in there, I don't know that I honestly don't feel like they respond quite as well to the regenerative therapies such as IRAP or PRP. So I think if financially people can afford it, I try to encourage people to use IRAP for joint injections. So it's a case by case, but I've had such great results with it. I mean, I could share 50 other cases that were great success stories with IRAP.
Yeah, well, it's cool to see how the joint therapies are evolving and we're continuing to learn more about how they work and what sort of cases they're really successful for.
Yeah. Yeah, I think veterinary medicine has come so far over the past 10 years or so with the orthobiologics, the regenerative therapies. There's just so many options that we have for these athletes nowadays.
Well, I really appreciate you coming on and sharing some of these success stories with us. It's cool to see. It's cool to see them in real life.
Yeah, it is. It's very cool. And I appreciate you guys having me on, and I'll give you an update on Huey.
Yeah, I would love to hear that.
Yeah, that'd be awesome.
Well, thank you, Dr. Gaddis, for joining us on Daily Vet Life. And thank you to Dechra for their support.
Yes, thank you very much.